welcome to my autobiography, Renal Drugs under Loop Diuretics. So under Loop Diuretics, I have 4 drugs under me, and the first of my name is bumetanide, with the brand name of Bumex and DIURETICS, and the chemical name is this. Second is the ethacrynic acid, with the brand name of Edequin, and the chemical name is this. Third of my name is the furosemide, with the brand name of Lasix, and the chemical name is this. Lastly is the torsemide, with the brand name of Demodex, and the chemical name is this. For my drug classifications, my therapeutic actions are antihypertensive, anti-edema, and lowering intraocular pressure. My pharmacology classification is under loop diuretics. For my pregnancy category, my bumetanide and furosemide are under category C. Animal studies have failed to reveal evidence of teratogenicity, and there are no data in human pregnancy studies. Thus, these drugs should be used only during pregnancy when the benefit outweighs the risk. For my ethacrynic acid and torsemide, they are under category B. Animal reproduction studies have failed to demonstrate a risk to the fetus, and there are no well-controlled and adequate studies in pregnant women. Thus, these drugs should be contraindicated and should only be used in pregnancy when clearly needed.
Mechanism of action. I inhibit import of sodium, potassium, and chloride primarily in the ascending limb of Henle, and also in the proximal and distal tubules. This pharmacological action results in the excretion of these ions, increased urinary output, and reduction in extracellular fluid. I also lower blood pressure initially by reducing plasma and extracellular fluid volume. Cardiac output also decreases, explaining my antihypertensive action. Eventually, cardiac output returns to normal with an accompanying decrease in peripheral resistance. My mode of action does not involve carbonic anhydrase inhibition. Pharmacokinetics. For my administration, several loop diuretics come in IV and oral forms. For furosemide, comes in oral tablet form in 20, 40, and 80 mg dosages. Injectable solutions come in 10 mg per ml doses. Oral solutions come in either 8 or 10 mg per ml doses. For torsemide, it comes in a tablet form in 5, 10, 20, or 100 mg doses. Injectable solution is 10 mg per ml dosing. Bumetanide comes in oral tablets of 0.5, 1, and 2 mg doses. IV solution is 0.25 mg per ml. Ethacrynic acid is available with oral tablets of 25 mg and in a powder form for injections at 50 mg. Furosemide has an average bioavailability of 50%, while bumetanide and torsemide are closer to 80%. The half-life for furosemide is 1.5 to 2 hours, but can be up to 2.6 hours in those with renal or hepatic dysfunction and heart failure. Bumetanide has a half-life of 1 hour and can be near 1.3 to 1.6 hours in those with renal or hepatic dysfunction and heart failure. Lastly, torsemide is known to have the longest half-life at 3 to 4 hours and can be as long as 5 to 6 hours in patients with renal or hepatic dysfunction. For my distribution, I am highly protein-bound, therefore I have low volume of distribution. I am metabolized in the liver and I am excreted in the urine. In the oral route, my onset is 60 minutes, peak is within 60 to 120 minutes, and duration is within 6 to 8 hours. In IV and IM route, my onset is 5 minutes, peak is 30 minutes, and duration is 2 hours. Indications. I am indicated for the treatment of edema associated with CHF, hepatic or renal disease including nephrotic syndrome, management of post-operative and premenstrual edema, edema accompanying disseminated carcinoma, and mild hypertension. I may be used concomitantly with the potassium-sparing diuretic and treatment of hypercalcemia. I can also be used concomitantly with mannitol for treatment of severe cerebral edema, particularly in meningitis. Contraindications. I am contraindicated to patients with anuria, history of hypersensitivity to furosemide, bumetanide or torsemide, or sulfonamides, hepatic coma, and severe states of electrolyte depletion. Side and adverse effects. For the body as a whole, patient might experience sweating, hyperventilation, and glycosuria. In the CNS, there might be dizziness, headache, weakness, and fatigue. For CV, hypotension, ECG changes, chest pain, and hypovolemia. For GI, there might be nausea, vomiting, abdominal or stomach pain, GI distress, diarrhea, and dry mouth. For metabolic, there might be hypokalemia, hyponatremia, hypouricemia, hyperglycemia, hypomagnesemia, decreased calcium, and chloride. For musculoskeletal, there might be muscle cramps, muscle pain, stiffness or tenderness, and arthritic pain. For special senses, there might be ear discomfort, ringing or buzzing in ears, and impaired hearing. Nursing responsibility. Before administering meat to your patient, you must first assess the patient for any history of allergy to bumetanide or loop diuretics, electrolyte depletion, anuria, severe renal failure, hepatic coma, systemic lupus erythematosus, gout, diabetes mellitus, and lactation. And for the physical assessment, it is to assess the skin color, lesions, edema, orientation, reflexes, hearing, pulses, baseline ECG, blood pressure, orthostatic blood pressure, perfusion, pattern, adventitious sounds, liver evaluation, bowel sounds, urinary output patterns, CBC, serum electrolytes including calcium, blood glucose, renal function test, uric acid, and urinalysis. During administration, give with food or milk to prevent GI upset. Give single dose early in the day so increased urination will not disturb sleep. Administer intravenous diuretics slowly to prevent severe changes in fluid and electrolytes. Monitor patient response to drug therapy like vital signs and weight and serum electrolytes to evaluate effectiveness of drug therapy. Provide comfort measures to help patient tolerate drug effects. Provide safety measures to prevent injuries and educate client on drug therapy to promote compliance. After administration, monitor patient response to therapy such as the weight, urinary output, edema changes, and blood pressure. Monitor for adverse effects such as electrolyte imbalance, hyperglycemia, hyperuricemia, and acid-base disturbances. After, evaluate patient understanding on drug therapy by asking patient to name the drug, its indication, and adverse effects to watch for. Monitor patient compliance to drug therapy. So that would be all for my autobiography of drugs under loop diuretics. I hope you learned something. Thank you for watching.